Of course, many of us this morning feeling helpless after seeing tragedies like this unfold, and the best we can do, be prepared in case it happens here.
And there's a program here in our area that will empower you to be a better responder in case of an emergency. Abby Larico is live at Mercy Hospital with how it can help save lives. Abby, good morning.
Hey, good morning, Allie and Heidi. So lives are saved at emergency rooms every single day, like the one here at Mercy Hospital. But the thing is, sometimes it is just too late. It takes as little as 3 minutes for someone to bleed to death from their injuries. But trainers with the Stop the Bleed program say that's still enough time to take life-saving action.
To have people feel comfortable that there is something that they can do other than call 911, there's something that they can do that can save somebody's life.
Programs being offered right here at Mercy today, as well as several hospitals and community centers in our area on both sides of the river in the coming weeks. The nationwide training program started after the Sandy Hook Elementary School massacre, and they've been teaching people what to do the moments after a serious wound, with increased interest after every big tragedy, of course, like the one we just saw in Florida. So what kind of things do they talk about? One big takeaway is the ABCs of Stop the Bleed. A, it stands for alert. Make sure people know you need help and make sure you are safe. B, bleeding. Find the bleeding and any wounds on the injured victim that you are trying to help. And C, compress. If you don't have a tourniquet or something you can use as a tourniquet, use medical equipment. You probably have in an emergency cabinet nearby, things like gauze and tape. Pack the wound tightly and compress it. Do not lift any of that padding to try to check to see if the bleeding has stopped, because that can interrupt the clotting process and just make things worse. First responders say that's the #1 mistake people make when they are doing everything else right. These are tips that you can learn at the program, which again is being offered here at Mercy today. But you can find a full list of the different sessions you can sign up for on ksdk.com. Of course, Allie and Heidi, these are things that nobody ever wants to have to use, but you can't know when you need to know them until tragedy strikes. Reporting live at Mercy Hospital, Abby Larico, 5 on your side.
Thank you, Abby.